Hello, everybody. Welcome back to the show, Science Facts and Fallacies, episode 224. My name is Cameron English, your host as always, joined again by Dr. Liza Dunn. Liza, it's been a long week. How have things been? How are you?
Things are crazy busy. It's already Friday. It's hard to believe. I don't know where the time.
Yeah, it catches up with you. Having a family, having a job, and all these responsibilities, and then you get to the end of the week and you're like, I still have more to do. It never ends.
It never ends.
It never ends. It's okay, though. I'm happy to be here. I always love doing this show. So let's jump right into this. We've got 3 stories to talk about, as always. And first up, IARC's aspartame report echoes globally rejected glyphosate cancer determination. Next up, alcohol is good for you. Alcohol is bad for you. Here's yet another study to fuel the ongoing debate about booze. And finally, should you be concerned when you read that a chemical in your food has been linked to cancer? Here's an expert checklist to detect overhyped health scares. Very useful resource that I'm excited to talk about. But let's dive into this first story. This is by our friend, Dr. David Zarek, writing for the Genetic Literacy Project. David is great because he does a lot of the investigative work that many journalists refuse to do. So he looks into different organizations that take certain perspectives on the dangers of chemicals. He looks into the research they cite, the research they perform. He looks into the law firms they work with, and he draws these very interesting connections that are frankly shocking in some cases, but they just don't reach the headlines for one reason or another. So in this case, he's talking about a sweetener that everyone's widely familiar with. It's called aspartame. It's in energy drinks. It's in diet soda. It's in juice. It's in all kinds of stuff. And it's great because it's zero calorie, essentially, right? Just a little bit of it. It's very sweet relative to sugar. So you can enjoy a sweet drink or a dessert or whatever, and you're not getting a ton of sugar, which is great, especially if you're diabetic or if you want to lose weight or whatever. Now, over the decades, going back 30 or 40 years, there's been study upon study upon study of this chemical and every other sweetener that's been authorized for use in the United States or in Europe or in Canada. You have the Food and Drug Administration here, but you have the European Food Safety Authority in Europe. And as we'll talk about, there's a body within the World Health Organization. They don't have regulatory authority, but they review these chemicals, and other experts in the field, governments take those analyses very, very seriously. And what everyone has found is that these chemicals, or let's just call them food additives or sweeteners, they don't pose any risk, right? So if you dose a rat with like 1,000 times what humans are allowed to consume, something weird might happen. But that has more to do with your bad study design and less with the chemical itself. But when you do studies where humans consume reasonable amounts of it, when you do epidemiological studies that look at people who actually consume these, you don't find anything. It's only when you do these weird cell culture studies or these strange animal models that we've talked about, that's when you find a problem. So none of this, of course, has stopped the activist groups who we've talked about before. And it's interesting, they tend to coalesce around issues, right? So if they're afraid of pesticides, they're also afraid of sweeteners, and they're afraid of sugar and soda and on and on. Anything that you might derive a little bit of enjoyment from, they are scared of it.
They're afraid of joy.
Yeah.
They're afraid of joy and happiness.
That's right. Red meat, alcohol, sweets, just anything that within moderation is fine. These people want to get rid of it because they're unhappy for whatever reason. But here's the problem, though. If you're an activist group or you're a law firm that works with an activist group, you need science to go into court. You can't just go in and sue, whatever food manufacturer and say, I think you're evil. You need some semblance of data or some argument to justify to a judge or to a jury to say this is bad. And what appears to be happening here is that the International Agency for Research on Cancer, or IARC, which it's typically called, seems, I don't know how to put this diplomatically, they seem a little less concerned about being rigorous So when it comes to, I'll jump in here in a second, but when it comes to a body like it's called the JECFA, or the Joint Food and Agriculture Organization, WHO Expert Committee on Food Additives. These are the people that will really dive into the data, and they will do a risk assessment. And all that basically means is you have to consume this amount of a chemical over this period of time in order to experience whatever harm is in question. Right? That's what a risk assessment is, more or less. What IARC does is called a hazard assessment. They just look at all the literature, all the studies that have been done, and they say, well, at some particular dose, this chemical could cause cancer. And that's the extent. Oh, go ahead.
Add all of the studies, though.
That's a good point.
Pick the studies because they don't have time to look at the whole body of studies that a regulator would look at, because it's about 17 to 20 panelists that will evaluate maybe 3 or 4 chemicals at a time. And it'll be over a 1, 2, or 3 week period. Whereas with regular regulatory studies, you will have hundreds of scientists evaluating all aspects of a chemistry before it ever gets on the market for a period of over 10 years sometimes. And looking at really closely evaluating the data. And that includes industry data, which is often not published. And the reason why it's not published is because you don't tend to find the, big, huge effects when you're doing, studies. Because if you were to find big, huge effects that were detrimental to health or the environment, you wouldn't put it on the market. So it's not a good business model to, sell things that ruin things because then you won't have anything to, to improve. So long and short is the International Agency for Research on Cancer looks at a very, very small subsection of all of the studies that are out there about chemistries.
Yeah, it's a very good point. There's a lot of examples that we could talk about. I don't think we need to get into all of them, but there have been situations where they will conduct their hazard assessment. And in some cases, the scientists on the IARC monograph panel are authors of research that's relevant to the chemical in question. And that research is excluded from the monograph discussion and the monograph analysis. And at least to me as a layman, that doesn't sound acceptable. Because right, if you're a bona fide expert on this and you're doing research that tells us something about the cancer risk of a chemical, what reason do you have not to include that in right. this massive study you're putting together? What are your thoughts on that?
So it's a small panel. They can't possibly review all of the literature that's out there. There's just no way. It's too small of a group and too short of a time, and there's just too much literature out there. So they pick publicly available literature, but they choose which publicly available literature that they will review. And the other issue is that the reviewers aren't always experts on the chemistries they're reviewing themselves. So they will be, reviewing things chemistries that they actually don't have an in-depth knowledge of. So, and this is not everybody, but there are certainly a lot of people who, are evaluating chemistries that they don't know about with an incomplete data set. And they quite often find themselves at odds with hundreds of regulatory agencies around the world. And they quite often find themselves at odds with the expert scientists who truly have enough background and have done the research themselves on these products. And it sets up a difficulty in organizations like the World Health Organization, because you have actual regulatory agencies and actual agencies with very validated risk assessment studies in having completely different findings than the International Agency for Research on Cancer. And that, gets people very confused. And there needs to be some maybe realignment of how this operates, because it causes actual huge problems for taxpayers. Taxpayers, when IARC finds that something is a probable carcinogen, that starts a whole big, huge snowball effect where people start demanding more and more research. And so more and more research is done on a substance. And for this aspartame, there've been hundreds and hundreds, if thousands of studies over decades. And a lot of that's done at taxpayer expense. And so it's a real, once the question is really settled with a huge number of scientists and the data are very clear, it becomes very hard to try to keep on having taxpayers have to pay for more and more studies that show that there's not going to be that there won't be harm.
So I believe this latest monograph from IARC, it's going to be published as part of this wider WHO report on aspartame, which is going to be interesting. I don't know if that's been done before because they typically publish their own monographs, but I will have to see what's in it. But I'm very curious because I'm almost certain that this other agency within WHO is going to look at all the evidence and say, okay, yeah, here's the dose response effect that you can expect. Here's how much you can safely consume. And then IARC is going to say, and again, I'm speculating. I don't know. Maybe they won't do this, but I suspect they're going to say something like it could cause cancer at, if you if you do 10 jumping jacks, then you dive into the ocean and then you eat 10,000. You know what I mean? Like they could just do that. So I'm curious to see what happens, but I'm equally interested to find out how the media is going to deal with this. Because I have no secret here. I deeply despise most health reporters because they're not informed. Speaking as someone who's done this for a living, they're not informed. They generally don't care to be informed. They do what's called dial-a-quote, where they just find someone with letters after their name who's going to tell them what they need in order to get a scary headline. New study finds thing you eat every day could cause cancer, right? That's all they're looking for. So I guess maybe this is just a real world example, Liza, of what everyone needs to do, which is be skeptical, read this as carefully as you can, and look at different sources of information and try to make a determination based on that. Don't light your hair on fire because you see a headline that says, diet soda causes whatever.
Headlines are in the business of making money, as are many of the people that are involved in these debates. And so I think it's very important to understand that once again, the 20th century and into the 21st century, we have had an unprecedented abundance in health and our quality of life. And it's because of these scientific advances that make our lives better. Now imagine being a diabetic kid and you can't eat sugar, and you've got this as an alternative. And taking this away because of speculation really does a disservice to people who are, would like to enjoy the same quality of life that we do. And it's, it's speculative and it's harmful, and it's really, really unfortunate that that this is the way a lot of chemistries are treated.
It's a sad fact of the world we live in. I would recommend, as we wrap up, go read David's article. There's so much content in here. He talks about the experts, or apparently not so expert people that are going to be on this panel. He talks about the research that's been done. He talks about the groups that are pushing for this monograph to be done. There's a lot of interesting asides and nuances here. So dive into the story.
He is a deep dive, and if you want to know really the sort of behind the scenes reasoning behind a lot of the things that you're seeing that people are concerned about these days and that are in popular press these days, he will give you an in-depth analysis with documentation all the way through. So he's a fantastic resource and very underutilized.
Yes. I think he says unpopular things. And as much as reporters talk about their commitment to the truth and democracy dies in darkness, I don't think they really want the truth on a lot of these things. So
on a lot of these things.
Go read David's article. And let's talk about what might be the most annoying topic in the world, Liza, which is the alleged health benefits and risks of alcohol consumption. So this is a story from CNN by Deidre McPhillips and Brenda Goodman. And the headline is GLP's headline, right? Because they're saying, look, there's a billion studies on this. CNN was a little more gentle. So they say small amounts of alcohol may turn down stress in the brain, benefiting the heart. New study finds. So the basic idea here is that you have studies going back decades. Some say moderate alcohol consumption reduces your heart disease risk or your cardiovascular disease risk. Other studies say there's no benefit, there's nothing. Some say it's actually worse for you for one reason or another. Basically, you can pick and choose whatever study you want to look at. So if you want to take an anti-alcohol stance, you can find epidemiology to support that. If you want to push a little bit of wine's good for you, you can do that too. It's really up to you. That's just the extent of the literature. So the problem here is that there are a lot of scientists who want to get to the bottom of this issue. And so there was a study conducted recently where they're trying to figure out, is this heart benefit real? And what's the mechanism? After all these decades, they still really don't know. So these researchers, they looked at people, and I just get frustrated saying this. They looked at people who had between 1 and 14 drinks per week. And in this group, people were less likely to have a heart attack or stroke than those who had less than one drink. So if you have between 1 and 14, you have a reduced risk. And if you have less than 1, you're in trouble. Okay. So this is the population of people, and it was thousands of people. There are participants in what's called the Mass General Brigham Biobank, which is just a database that keeps medical information on people. I believe
it's like keeping track of, it's like a database that sort of keeps track of, health outcomes in a variety of different situations.
Right. So, how much do you weigh? Are you sick? Just all these basic things that are useful to keep track of. And then they also analyzed brain scans of hundreds of these people because they're trying to figure out, well, why is this? And what they found is that people who were light to moderate drinkers had a reduced stress response in their amygdala, which is a part of the brain that processes fear and threats. So I think the basic gist of this is that you consume a little bit of alcohol, it lowers your stress level, causes some changes in the brain that reduce inflammation, which ultimately reduces your risk of cardiovascular disease. I think that's the gist of it. Liza, correct me if I made a mistake there.
No, that's the gist of it.
Okay.
Yeah, and it's called the amygdala. And the amygdala is the sort of a relay station in your brain that translates information from sort of the more primitive areas, your fight or flight mechanisms, right? You see a dinosaur and your instinct is to run away. So you have a whole bunch of physiologic responses to help facilitate that. Your blood pressure goes up, your heart rate goes up, your eyes dilate so you can see around you and things like that. And then, so that's like a survival kick-in mechanism that uses different neurotransmitters or chemicals in your brain and in your peripheral nervous system to get that all kicked in, right? And it's a physiologic response. Now, the amygdala also feeds into the frontal cortex of your brain, which is where your executive function is. And that executive function sort of regulates how you interact with the environment. So you can override that fight or flight mechanism if you can rationalize, why something's there. So we're not always on edge. Now, for some reason, some people have a higher level of anxiety than other people. And some people think that might have to do with amygdala different phenotypes, I guess, in the amygdala. And so the amygdala is, often blamed for all sorts of various and sundry problems, anxiety, anger, psychopathy, a whole variety of different things. But I think long and short is people really don't know what it does. Now, we know that alcohol in moderation doesn't seem to cause too many problems, right? I think if alcohol, we've evolved with alcohol. People drank alcohol before they could drink water because it was safer often than water, right? Way back when we didn't have water sanitation, for example, and now everybody's saying, oh, we want to have, raw water again to reconstitute our microbiomes. I think that probably puts you at a higher risk of disease and mortality than, a glass of wine occasionally. It may be that a glass of wine does, not just in the amygdala, a glass of wine actually works on your GABA receptors in your brain. And GABA is the main inhibitory neurotransmitter in your brain. So it makes you relax, and it's a general brain function. So it's not just the amygdala that's going to happen too. So a glass of wine is going to generally make you relax. Now, if you wind up drinking way, way, way too much, you're going to get drunk, and your brain is going to make accommodations for that, right? And your brain, the GABA receptors in your brain, because they're being constantly stimulated by this central nervous system depressant, you start out being sleepy, right? But if you do that chronically, your brain's going to start down-regulating those GABA receptors and up-regulating excitatory receptors, because it's going to say, I need to be awake, right? And so you actually shift the receptors in your brain in order to stay awake. And that's the mechanism behind tolerance. That's why people can drink more and more and more and more and not get clinically intoxicated, because they have become professional drinkers. So long and short is, I think this is more complex than the amygdala itself. And the amygdala is blamed for a lot of things. And I think that you have a very basic biochemical reason why people get relaxed when they have a drink or two. Everything in moderation, right? And I don't think people who don't drink need to be scared that they're going to die of a heart attack. And I don't think that people who do drink a little bit think that they should, they're protected from all sorts of diseases. What we do know is that regular ethanol use is associated with an increased risk of different cancers. So you just have to be aware of that, especially breast cancer. And then excess alcohol use is a problem across the board. So everything in moderation.
Sage advice, as always, from our resident ER physician here. My first response to this study as I was reading through it was, who cares? Because, later today, I'm going to have a Jack and Coke and watch a movie I've seen 1,000 times, and it's going to be a great Friday night. I'm not going to think twice about my heart attack risk, or I'm just not, But what you just said makes a lot of sense, in that it seems like there could be something here. And the way that they described it in the CNN article was, those first couple sips of alcohol before you get that buzzed feeling, before the intoxication starts, you can feel your muscles sort of relax, and you go, oh, right? So that it makes sense that over time that would lead, within, as you said, within moderation, that would lead to some reduced risk of stress and perhaps inflammation.
Exactly.
That makes a lot of sense to me. So maybe they are onto something here. Obviously, they're going to say, more studies are needed, and we're going to keep studying this at taxpayer expense for the next 30 years. But this is Yeah. They've pinpointed something. It looks like it seems to me it's like every 1 out of 10 studies I read about, somebody happens onto something interesting, and maybe this is one of those. All right, let's move on to our last study, which is helpfully relevant to what we're talking about. This is an article by Dr. Jeffrey Cabot, been on the show multiple times. He is a cancer epidemiologist by training, as we've said. He can be gentle, but factual and honest, which I really appreciate. So he will take on issues that don't win him friends and don't help him influence people, but it informs the public about some really important issues. So here he's talking about his checklist for assessing research that you read about. So like this alcohol study, or something about marijuana or cigarettes or whatever. It's really good stuff. So I don't have much to say about this, Liza, except that I would like to go through this checklist he put together.
Sure.
And just get your your insight on this, but for just basically for people who aren't aware, most of the studies you read about in headlines are epidemiological, meaning that they just look at a population of people and they assess some food or some drink or some exposure that they have relative to a particular health concern. And they're trying to uncover, potential harm. So this is really what led to our understanding of lung cancer and smoking, for example, is when you do epidemiological studies, you go, wow, these people get lung cancer at an astronomically higher rate than people who don't smoke. And there's been lots of, not lots, but there's been a handful of big discoveries like that over the last 100, 150 years, whatever. And it's due to epidemiology. But one of the points Dr. Cabot has made in a lot of his articles is that all the sexy stuff has been discovered, right? So everyone in epidemiology now, they're left doing, I think, what he calls risk factor epidemiology, where you're looking for, particular and very discrete effects on your health from some behavior, So like the alcohol one is a great example, right? So it's not that like if you drink a little bit, you're going to get cancer the next day, but you could drink a little bit, maybe it reduces your risk of heart disease. If you drink a lot of it, maybe it has the opposite effect. So that's what he's talking about. And he just goes through, and there's like 10 or 12 bullet points. We can go through some of them. And he just says, here's what you need to be aware of as you're assessing these studies. So let's go through some of these, Liza. I'm really curious to get your insight here. So his first one is, what is the finding or the main result? So with that in mind, why should I care about that? Like, why does the main result matter to me?
Because the main result is whether or not it's an association and whether or not that association is causal. Is that main result likely to be caused by the exposure, right? So you can say that, for example, there's an association between organic food consumption and autism. And you can draw a graph that shows clearly that organic food consumption has increased over the past 20 years, along with the incidence of autism. Now, are those causally associated? Not at all. Some people eat organic food. Some people don't eat organic food. It is a completely spurious association. And you can make those claims with all sorts of different exposures or chemicals or things like that. And the trick is to figure out whether or not there is a plausible reason for there to be an actual causal association. And that is encompassed in the Bradford Hill criteria. But we can go through this list. I'm just pulling up the list that he's gotten in his article right now. So you go ahead and keep on talking.
Yeah, another one that I find really helpful that he talks about, and this is further on, and he says, do the authors report the absolute risk as well as the relative risk? And he just says absolute risk conveys the population impact of the factor, which is the exposure they're studying. How many cases of the disease would be prevented if the factor were eliminated? And this is really interesting, and it's very helpful because if you read these studies, they'll say something like, I don't know, eating tater tots increases your risk of, having a bad attitude by 50% or whatever, right? So that's the relative risk. Now, what could have happened is it's a study of two people, or, it's like a study, I don't know. They could say like, well, there's one person, and then when they eat too many tater tots, it increases their risk of a bad attitude by an additional person, right? So that's a 50% increase, but, it's a very, very small number of people we're talking about. And that happens all the time. That was a very silly, oversimplified example, but this happens a lot in these studies. It could be a very small population and they'll say, 27% increase in whatever.
That's right.
But it's very, very tiny. So add some insight to that, if you would.
Yeah. So in order to say that there's actually, once again, a causal association, you need to see it over and over repeatedly again in a population, and it has to. And it should be a big enough a population that the association actually gets stronger with the exposure. So in Bradford Hill's criteria, the effect size is what's really important. It's the strength of the association, right? So a small association doesn't mean that there's a causal effect. The larger the association, the more likely it is causal. And in the reproducibility of that too, right? So you've got to have consistency and reproducibility over and over again. So we started seeing this pattern as people started smoking, that they were getting lung cancers and head and neck cancers, and that you could see that consistently in large groups of smokers as opposed to non-smokers. And as the smoking declined, we saw it drop off.
Gotta love dogs, everybody. It's just the reality of life. You're still muted.
He's saving me from the mailman.
God bless his little heart.
He's a very ferocious pug. So that's why you need a consistent, reproducible, large number of people to make associations that are leaning more towards causality.
Yeah. The point I was trying to make earlier, just to clarify, this came from a study or an article that was written by a couple of epidemiologists. And they said reporting the relative risk without the absolute risk is very, very misleading. And so they said, a hypothetical drug that reduces death rates from 0.002% to 0.001% reduces mortality by 50%.
Which is, yeah.
Right. So, So relatively, that looks massive. But it's not like it's like clinically useless to take a drug like that.
Exactly right. And it's torturing the data until it confesses.
Yeah. As a side note, you did a debate or a discussion with some anti-vax folks a little while back. And I remember one of them was like, "Are you familiar with the Bradford Hill criteria?" And I just went like, yeah, I'm sure the toxicologist doesn't know anything about that. Thank you for bringing that up. Okay, let's move on to a couple more of these before we wrap this up. So Cabot also talks about, let's see, what's another good one? Here's a very important one. He says, how does the result accord with the results of other studies, right? So as we were sort of alluding to earlier with the IARC article, you could have one study that shows a dramatic increase in risk for one reason or another. But if you have, 450 other studies that cannot reproduce that effect, that should raise a red flag. And you should at least suspect that there's something wrong with this one study, or maybe they did something differently than the others have. But I guess the takeaway is one study doesn't prove anything.
It doesn't prove anything. And it also, if you've got a group of studies that are showing things, you may have I guess what people get very concerned about is that you might have a very low risk or a signal that you have too small of a population to follow, right? And so that's what like pharmacovigilance is about for pharmaceutical companies, right? So if you've got a drug that you're putting on the market, you do all of the safety and efficacy studies first in a very big population of people, so you get an adequate power to find adverse effects. But people then get concerned that later on maybe there are some very, very rare diseases, right? And so how do you know that you're not missing those rare diseases? And that's what pharmacovigilance is about. Is now that this product that's out in the market and you are literally treating millions of people, you can make sure that there are no very rare side effects at all. And sometimes if there are rare side effects, it will be taken off the market. But you are required to monitor for that kind of thing. So when you're looking for very common side effects and you've got study after study after study and looking at, hundreds of thousands of people, and there are and the product has been in the market for ever and ever and ever, you can kind of get the idea of coherence, right? That coherence, that there should be coherence between epidemiology findings and really sort of laboratory findings. That you're not going to have like a pick up some rare signal that needs more and more study that keeps on being negative, right? And then also not have anything that you've seen in the lab. So that you want the coherence is sort of agreement between epidemiology and lab studies, but it also is once you've got this whole group of epidemiologic studies looking at the same question over and over again, you can rest assured that you're not really going to be missing on anything significant.
And there's others we could go through. The final one I think is important to focus on, according to Cabot, is although the authors often point to a biological mechanism that could explain the result, we should keep in mind that one can always find a possible biological mechanism to explain a given association. So I think all he's saying there is when you read studies of this nature, deep in the discussion section towards the bottom of the paper, they will say, this study is only an association. We can't prove causation. However, according to this research or our own speculation, we think that, a mutation in such and such gene or, whatever could explain our results. And
that's why you need to have biologic plausibility really sussed out. And once again, this is where coherence comes into play. These Bradford Hill kind of all sort of blend into each other. You need to have a dose response. So the dose is, the dose is actually what, is what everything's toxic at a certain dose. Water is toxic at a certain dose. I've taken care of patients with water intoxication, right? So you've got to have a dose response. You should have laboratory evidence sort of corresponding with epidemiologic evidence. If you have strong epidemiologic evidence, you should have a mechanism, a plausible mechanism for what's causing this problem. And I think that we really need to look at epidemiologic studies critically to make sure that we're not making these, once again, headline claims because of associations that might be mathematically true, but are not necessarily biologically meaningful or clinically meaningful. So we've got to be very careful about headlines like that. And then one of the interesting articles that he had linked in this study was about the reduction of colorectal cancer in early onset colorectal cancer in people who had low sugar diets. And so sugar alternatives were, so aspartame, for example, were associated with a decreased risk of early onset colorectal cancer. So that shows you that you can have findings in studies that will point you in one direction or the other, but you really, really need the sort of coherence of evidence, the weight of evidence really actually will give you a much more informed decision about whether or not you are at risk of something with these epidemiologic studies.
It's so funny you bring up the colorectal cancer study that he's written about. I wrote an article about that a while back, and I just looked just for funsies, right? I looked through PubMed, and I found there's studies that say there's no association between sugar and colorectal cancer. There's some that say apparently consuming sugar reduces your risk, right? Or consuming less reduces your risk. So it's just it's funny how the associations are all over the place. You see the same thing with diet. Vegan advocates will say, cut out meat, it'll reduce your risk of blah, blah, blah. The low carb paleo people say the same thing, but cut out all the soy and all the vegetables and eat lots of meat.
Cut up all the fat, all the seed, everybody's going to eat bugs. We're going to cut out alcohol, drink more coffee, do coffee enemas. There's so many things. So many things out there and so much mixed in information, and it's all everybody's trying to get people to do things for their own good. And my favorite quote of C.S. Lewis, if I may, is of all tyrannies, a tyranny exercised for the good of its victims is most oppressive. It may be better to live under robber barons than under omnipotent moral busybodies. The robber baron's cruelty may sometimes sleep, his cupidity may at some point be satiated, but those who torment us for our own good will torment us without end, for they do so with the approval of their own conscience.
That's very good. C.S. Lewis could turn a phrase.
He sure could. So everything in moderation.
Good stuff. Absolutely. Well, we're going to leave it there. And there's a subtle passing recommendation. Read C.S. Lewis. You'll learn lots of great stuff. And then
sure will.
read all these articles as well. Again, so the one we just went through for Dr. Cabot is called Should You Be Concerned When You Read That a Chemical in Your Food Has Been Linked to Cancer? Here's an expert checklist to detect overhyped skiers. Really good stuff. And we're going to call it a day. Oh, one more thing. Go ahead.
I was going to say, and this is actually more fun to read than the Bradford Health Criteria.
Yes, it is. Although you should probably read that at some point too. Follow us on Twitter until our episode next week at Dr. Liza Dunn, MD, at CamJ English, Genetic Literacy Project at Genetic Literacy, and we will be back in exactly 7 days for episode 225. Thank you as always. See you then.
Weekend.